Welcome back. That was a short little break. I hope that you got a coffee and you're ready to step back into something that I'm so excited to be able to take in. They're called lightning talks, and they're four concise 3-minute presentations highlighting key research findings and knowledge mobilization activities, and how they impact the neurodevelopmental disability community. There will be a live Q&A section. So take your notes, really, I think lean in and soak in as much as you can in those really quick moments. This lightning talk section is sponsored by Queen's University, the Faculty of Health Sciences. And I want you to meet the moderator, the phenomenal Dr. Carmen Rasmussen, Associate Professor of Neurodevelopment in the Department of Pediatrics at the U of A, University of Alberta, my alma mater, and co-principal investigator on the KBHN-funded COP Mile project. Dr. Rasmussen, welcome to the show.
Thank you, Jody. So today I will be moderating the session for the Trainee Lightning Talk. So I'd like to welcome everybody to this session. I'll start by introducing the speakers, and we will have a question and answer period after all four speakers have completed. So the first speaker today will be Myra Malik, who will be speaking on gray matter volume in children with developmental coordination disorder before and after rehabilitation intervention. The second speaker will be Malika Kangarani Farahani, who will be speaking on motor impairment in children with autism spectrum disorder, a systematic review. The third speaker will be Vanessa Boyla, who will be speaking on engaging with the community of practice to adapt a mathematics intervention for broad implementation in elementary schools with all students. Finally, the fourth presentation will be by Rosalie Dosti, who will be presenting on acceptability of a tele-rehabilitation intervention designed to support families with children aged 3 to 8 years old with motor difficulties. So I'll remind the audience that there will be an award for the Trainee Lightning Talks after both Trainee Lightning Talk sessions to today and tomorrow. And I'll also ask the audience to write your questions in the chat, and there will be a question and answer period after all four talks have completed. I'll also note that Myra is not able to attend the live question and answer due to technical difficulties, so there won't be any questions for her to answer during that time. So I will now hand it over to start the Trainee Lightning Talks. Thank you.
So thank you for the introduction. So developmental coordination disorder, also abbreviated as DCD, is a neurodevelopmental disorder that affects approximately 5 to 6% of Canadian school-age children. Individuals with this disorder have difficulty with motor-based activities such as biking, and DCD co-occurs alongside many other disorders, with the most common one being attention deficit hyperactivity disorder, also abbreviated as ADHD. Currently, one of the recommended interventions for children with DCD is the Cognitive Orientation to Daily Occupational Performance, also abbreviated as COOP, which is a 10-week client-centered intervention that uses the goal, plan, do, check framework to accomplish their goals. Since DCD is a neurodevelopmental disorder, we can examine the brain. However, it remains unclear on how the brain morphology, specifically volume, appears in children with DCD, and if after co-op intervention, if any neuroplastic changes were to occur. So to explore this, children with DCD and ADHD, and typically developing children underwent MRI scans, which was used for baseline analysis, and then children with DCD and ADHD were then randomized into either the treatment or waitlist group, each receiving 10 weeks of co-op intervention, and underwent MRI scans after their intervention period, and this was used for the intervention analysis. So for the results, compared to typically developing children with DCD had significantly greater gray matter volume in the left superior frontal gyrus, which is involved in cognitive functions such as working memory. For the pre-post intervention analysis, it was found that after co-op intervention, Children with DCD had significantly decreased gray matter volume on the right hemisphere, specifically the superior frontal gyrus, the posterior and middle cingulate gyrus, which has a role in inhibitory control, self-regulation, and voluntary thinking, respectively. And this is consistent with how co-op is actually thought to improve function through self-regulatory mechanisms. So what does this all mean? Well, to make sense of this, we can look towards synaptic pruning, which is defined as the targeted elimination of less functional or extra synapses to improve connections in the brain. It may be that altered pruning mechanisms could account for the greater gray matter volume, and that after co-op intervention, it elicits some brain activity which helped increase synaptic pruning, therefore hence the decreased gray matter volume. The results of the study are actually further supported by the previous work in the Zwicker lab, as it was found that children with DCD have altered white matter development as well. And our results add to the story that children with DCD may have altered gray matter development, therefore suggesting that DCD may be a result of altered brain development. And that brings me to the end of my presentation. Thank you for listening, and here's the acknowledgements for this work.
Hello, my name is Melika, and I'm excited to share with you today our work describing motor impairments in children with autism. I would like to acknowledge that the land on which we gather in the unceded territory of the Coast Salish people, including the territories of Musqueam, Squamish, and the Tsleil-Waututh nations. Children with autism spectrum disorder often have motor deficits such as poor motor fine skills, difficulty with printing, decreased coordination, and trouble with balance. Research has shown that motor deficits occur in 50 to 85% of children with ASD, yet motor concerns are not part of the diagnostic criteria for the disorder, nor are they typically the target for therapy. Motor problem can profoundly affect academic, social, and communication skills of children with ASD. The profile of motor difficulties observed in children with autism is consistent with another neurodevelopmental condition called developmental coordination disorder or DCD. DCD is characterized by significantly difficulty in learning motor skills and performing daily activities. Since the publication of Diagnostic and Statistical Manual in 2013, a dual diagnosis of ASD and DCD has been permitted, but we hypothesize that DCD is under-recognized and underdiagnosed in this population. In this systematic review, our primary aim was to investigate the nature and prevalence of motor problem in children with ASD. Then we wanted to examine if the term DCD was used to describe these motor deficits in publication after 2013. 26 studies met the inclusion criteria and were reviewed for study quality by two independent reviewers. The study used various motor and function measures such as movement assessment battery for children and developmental coordination disorder questionnaire. Results indicate that the majority of articles reported that children with ASD had significant motor impairments on a standardized motor assessment or functional measures. The prevalence of motor problems ranged from 50 to 87%. However, only 3 out of 19 papers from 2014 identified these motor difficulties as DCD, with one study reporting that only 15% of children with ASD with motor difficulties have been given a DCD diagnosis. Functional motor difficulties are highly prevalent in children with ASD, but evidence suggests that DCD is under-recognized and underdiagnosed in clinical population. A diagnosis of DCD is important to increase awareness and understanding of the motor skill deficits for the child, parents, coaches, teachers, and others who working with children with ASD, and access effective evidence-based therapy for DCD to address the motor skill deficits, which can also improve the core deficits associated with ASD.
The Math Interactive Learning Experience, MILE, is a 6-week math intervention for children ages 3 to 10. It was designed by Drs. Cable and Cole to improve children's math skills, support cognitive development, and assist with behavior regulation. Research conducted on the MILE program shows promising results. However, MILE was originally designed for one-on-one delivery. When small group instruction was examined, it proved to be time-consuming for educators, and MILE was previously delivered only to students with disorders such as fetal alcohol spectrum disorder. Thus, a community of practice was formed. A community of practice is a group with expertise in a certain area who gather to learn together and work toward common goals. 2 professors, 2 graduate students, and 6 educational stakeholders formed the COP. From 2020 to 2021, the COP met several times for 90 minutes on Zoom. During the meetings, COP members discussed the MILE program and provided suggestions to achieve broader use in the classroom for all students. Using the suggestions, the graduate students revised and created new MILE documents. At each subsequent meeting, they sought further feedback from the COP. The process was very iterative. Next, we will review some of the revisions and new creations. We revised an observation checklist by adding color to guide educators in their observations, changing language to align with the way educators communicate, and connecting suggestions for remediation to the errors students make. We created 5 error analysis tables. By using Dr. Lynn McGarvey's learning progressions, including 5 math strands and their corresponding conceptual threads and errors, we provided information about suggested activity pages that can be used to remediate these errors. Given that the activity pages are from the original MILE program, we didn't change their content, so some changes we made were more focused on how the MILE program resources are used. Additionally, we revised a lesson plan template so educators can more easily record observations of students' skills and behaviors. As well, we created a student progress monitoring form so educators can quickly and easily monitor the progress of all students, not just a select few. Currently, we're developing a website so anyone can access and use the MILE resources. Before making it publicly available, we'll collect data. Educators will complete a survey about beliefs related to their ability to teach math. 4 months after using the MILE resources, educators will complete a follow-up survey. This will help our research team better understand how educators use the MILE resources and how and if beliefs about teaching math changed. Thanks for listening.
Thank you for the introduction. So, children with motor difficulties might have a disability, a physical disability associated with a diagnosis such as developmental coordination disorder, or might have a difficulties with motor planning and execution, for example, tasks like running or writing. These children frequently require rehabilitation services, but unfortunately, accessing services will be difficult for those with so-called mild difficulties. Recent studies have shown that tele-rehabilitation might be a promising avenue to increase access to support for these children. However, given the rapid uptake of tele-rehabilitation during the COVID-19 pandemic, concerns have been raised that those services might be poorly designed and receive limited acceptance by families. So to explore this concept, we offered a tele-rehabilitation intervention to support families with children living with motor difficulties. The result of our study suggests that the intervention was perceived to be acceptable to all parents. They voiced many improvements in their child's life. But one of the major outcomes that I want to share with you today is the effect it had on parents. One mother told me that the intervention allowed her to become aware that her son had real and big challenges, and that he was not lazy. It was hard for real. She told me it changed her perspective and brought her to face her son's problem with a new vision. Parents voiced that the intervention gave them confidence and tools to be able to support their child's development now, but also in the next challenges to come. Even though some parents loved the way the intervention was provided, some raised concerns in regards to the burden it might put on them with the extra time they had to invest at home. On the other hand, some mentioned that since they didn't lose time with commuting, they had more time to invest with their child's implementing activities and strategies at home. Another important point that was brought up is that when parents parents had realistic expectations in regards to the possible outcome of the intervention and also a good understanding of how the intervention worked, it seemed to lead to a more enjoyable experience, meaning that as professionals, we must explain clearly the purpose and function of our tele-rehabilitation intervention because these type of intervention are new and families don't know much about them. To conclude, families seems to consider tele-rehabilitation as an acceptable way to offer rehabilitation services, but caution is needed while selecting and implementing services to ensure people understand it and that it responds to their expectation. So thank you everybody for your time and have a great rest of the day.
Thank you for the excellent talks. We now have some time for some question and answer. So if there are any questions from the audience, you can post them in the chat or in the question and answer. I'll just remind the audience that Myra is not able to attend the question and answer, so she will not be able to ask any questions, or she won't be able to answer any questions. So I don't see any other questions in the chat right now, but you can continue to keep posting them if you would like. I have some questions I can ask. So for Vanessa, what challenges did the community of practice encounter?
Yeah, so that's a really great question. We were working with a very diverse group. So we had educators who ranged from people working in the classroom with students all the way to administrators who were maybe playing a little bit of a different role. So we had lots of perspectives to integrate into the documents that we were revising. And so what we often found ourselves doing was in the document revision, we would oftentimes make multiple drafts, sometimes giving the community of practice members different options to select from. And so when we brought those documents to our community of practice, they were then able to say what they liked and what they didn't like. So some of the documents we created actually never made it into the final MILE program resources because they got sort of tossed in the revision stages through some of the feedback and the revisions that we did throughout that process. So it's definitely a challenge to integrate all those multiple perspectives, and how we did it was essentially through just creating multiple options and receiving feedback from lots of different members from our community of practice.
Great, thank you. We do have some questions coming in on the chat now. So the next question is for Malika Kangarhani-Farahani. What factors can often lead to a DCD misdiagnosis? Is it related to having another diagnosis like ASD? What should clinicians be on the lookout for?
That's a really good question. So actually, as we know, in the developmental coordination disorder criterion, we have four criteria for diagnosing the DCD. And as we investigate in the research, we can see that two of the criteria, which is related to motor difficulties and functional motor difficulties, are obviously related to DCD in children with ASD. As a research shown, about 50 to 87% of children with ASD has shown motor difficulties. So this criteria showed that these motor difficulties are separated from other motor difficulties that we see in the children with ASD, such as stereotypic movements and cliches, which is kind of related to DCD. That's why we see that children with ASD has mostly the motor difficulties that co-occurred with children with DCD.
Okay, great, thank you. I have a question here for Rosalie. What did parents think about using technology to receive care for their children?
That's an interesting question. So we saw in the previous literature that sometimes parents have a problem with using technology because they fear about confidentiality, and also they think that maybe like it's going to be less efficient than an in-person intervention. But in our intervention, what we found out is that it's completely the opposite. So parents didn't fear at all about confidentiality. So they had completely like confidence in the platform. They felt it was secure and that their information was secure. And also, so some parents mentioned that before starting the intervention, they were a bit unsure about the potential effects. But once they started to receive the Tele-Rehabilitation Intervention, they were all satisfied, and they said that it had like really good impact on their children difficulties. So I hope it answers your question.
Okay, great. Thank you. I see some more questions coming in on the question and answer here. So we'll try and get through most of them. This question is for Vanessa. Is there any limit to the size of group that the math intervention could be used with?
Oh, so that's a really great question as well, actually. So previously in the original MILE program, it was just for small groups. So it was actually designed originally to be a small group tutoring program. And that was a bit of an issue because teachers found that they couldn't always do the work that they needed to do with small groups because they did have, their large classes. So what we really tried to do in terms of adapting this program was actually make it suitable so it can be used with large groups and with small groups. And so there is really no limit. And the way we've designed it now, it can be used with small groups in addition to the large groups. So you can do small group work in the classroom if you'd like, but a lot of the activities lend themselves very nicely to sort of large group implementation. So there are lots of different ways you can use it, and there's really no limit to the size of the group. So that's definitely one of the challenges that we noticed in the past literature that we're really trying to address. And with the progress monitoring form you saw in the video, that's one of the ways where you could also monitor progress with any size of group. So one of the things we wanted to do was just make a quick and easy assessment that teachers or just about anybody working with kids could use to capture some data about how the children were doing throughout the use of the MILE program resources.
Okay, great. Thank you. The next question is for Malika. How did you define what significant motor difficulties were? Were these always above the DCD threshold or sometimes sub-threshold?
Pardon me, would you please repeat your question because I just disconnected?
Okay, it says, the question is, how did you define what significant motor difficulties were? Were these always above the DCD threshold or sometimes sub-threshold?
Oh, all right. So, as I told you in the previous question, it is related to the criterion of the diagnostic in DCD. So, these motor problems, which is more significant right now in children with ASD, as my research shows, is kind of related to the DCD problems. Is the nature of these motor problems are similar to motor problems and motor difficulties that we can see in children with developmental coordination disorder, because it is in either fine motor skills, gross motor skills, and it's obviously interfere with the function of these children in activities of daily living. So hopefully I answered this question.
Okay, great. Thank you. The next question is for Rosalie. How often the question is regarding how often the children received the intervention therapy.
Okay, so that's a good question, and I'm happy to receive it because I didn't explain a lot the intervention. So what we proposed was an online platform. It was available for parents for 1 year, so they could use it as they wanted. So they had like useful resources that were chosen by the research team. They also had access to a forum where they could interact with each other. There was also a private chat option. And finally, the most important part was coaching intervention that was delivered by a physical therapist or an occupational therapist. So during the year, the parents, they met with their professional and they established goals. And then it was really depending on their needs. So if parents wanted to focus, for example, on writing, so they could meet for 3 weeks every week, and then focus on like cues how to help the child with writing. And then after for a month, they couldn't meet because the parents didn't need to have a coaching intervention. So some parents only had 3 throughout the year, and some had like 24. So you see, it was like really depending on the needs of the parents and the children.
Okay, great. Thank you. I think we might have time for another question. I'm not sure if there's any new questions in the chat here. Vanessa, we'll have a question here for you. What data are you collecting in your survey?
Yeah, so we're kind of collecting a couple different things. We're definitely collecting some demographics about the individuals who are actually going to be using the MAL resources. We're also collecting some information about the impacts that COVID has had on educators right now and how that's maybe affecting what they're doing in the classroom with their students. And we're also collecting information about teacher efficacy in terms of their abilities around their beliefs around their abilities to teach math. So we want to know a little bit about that. And then once they've used the MAL resources for about 4 months, then we're also going to be asking them how they use the resources and if they have any suggestions for improvements, because as we continue with implementation, we want to make sure that this is indeed useful to educators. So we're also going to listen to some of their feedback and get a sense of what is working with what we've developed and changed so far, and what maybe also needs some more revision or some more thought around it before going into maybe a final implementation into the classroom with the teachers.
Okay, great. Thank you. I think that will start to bring us to the end of the question and answer period, unless there's any other final questions coming in on the chat here. I'm just checking. And if not, then I think we will hand it back over to Jody at this point. Thank you, everybody, for attending the session.
Oh, amazing. Thank you so much, Carmen, and all the Lightning Talk presenters for sharing your valuable research with the rest of us. Such insightful questions and comments. I love the interaction on the platform. Please keep that coming. These virtual events for speakers, I can tell you, when we know somebody's out there, it makes all the difference. So I love to see the question and the comments and all of the discussion. Now, what we're going to do is I want to invite you to click into the poster session. We're going to spend about an hour. It's up in the blue menu bar in Feed Loop. You can interact with the poster presenters via chat and video calls. And so I really want you to use this time to take a look at some of those things. The platform where it's set up is so interesting to me. The poster session specifically this year, the description is in line with the theme of this year's conference, focusing on, of course, partnerships in research. And our next, in this process is an opportunity to showcase the evolution of research partnerships and the impact that they've had. So the KBHN Family Partnership Community of Practice, the posters will be co-presented by at least one family member, and then an individual with lived experience an individual with lived experience and one researcher. So such a really unique, I think, connection between sort of theory and practice and what this looks like for those of us really experiencing this in the community. So the posters will present how the research engagement relationship has evolved and how joint decisions change the project over time. So again, for this, thank you, the Israeli Foundation and SFU for sponsoring the poster session. So I just invite you to jump over there and click on the link, and I will see you back in about an hour.